Good afternoon, everybody. Thank you for joining us on this beautiful first day of May. It's quite busy out there, and so we're going to try to get through this quickly, and so you guys can get back to your work. And I will be happy to answer any questions that you have. You can submit your questions through the webinar, and at the end of this webinar, you will be able to ask questions directly over the phone. So we'll get started. Again, my name is Mi-Young Kim, and I'm the Director of Communications and Outreach at the Colorado Health Benefit Exchange, which starting on Monday the 6th will become Connect for Health Colorado. So we're very excited about that change, and you'll see our new look later on in this presentation. So if moving on to slide 2, just wanted to give you an overview of the organization, what we are. And we are an open competitive marketplace, and we will be serving individuals, families, and small employers across Colorado starting in October. And our job is to help individuals, families, and small employers look at all of their health plan options, compare plans side by side, and also determine their eligibility for and access a new type of tax credit from the federal government to reduce the cost of health insurance. We also will be providing a variety of customer support mechanisms to help people through the process, and this will be available over the phone, online, and in person in your community. And then finally, of course, to finish the process and enroll in a health plan. We will also be assisting Coloradans with determining eligibility for Medicaid and CHP+. Okay, we'll keep going here. Just to clarify what some misperceptions that are out there about what we aren't. We are a public, nonprofit organization established by a state law. That state law is called Senate Bill 200, which was passed in 2011. And we are not a state agency. We are not a regulatory body and not part of Medicaid. We also aren't providing a new health insurance plan. There is no such thing as a Colorado Health Benefit Exchange plan. What we are is the access point to the private health insurance marketplace, so that when you come to us, you will be looking at plans offered by the insurance companies that offer plans through the state. So Kaiser plans, Rocky Mountain Health plans, Colorado Access. There will be many, many carriers who will be providing plans through our website. We also are not taking over the marketplace. And what I mean by that is that all of the ways that you get insurance today will continue to exist. And it is your choice how you get your insurance. And we are essentially providing a new option that we hope is attractive and better for people in Colorado to access health coverage. That second bullet around not negotiating rates between carriers and providers, that has to do with the way that we're set up through that state law. We are not what you would call an active purchase. And so as long as health insurance companies complete they get through the regulatory process through the Division of Insurance, they would be eligible to provide their plans through our site. And so we do not go to the carriers and direct them on prices or how they work with providers. And that last bullet I wanted to point to is related to our funding. Our funding comes from the federal government through grants. And then after the first year of operation, this will be starting in 2015, we need to be self-financing, which means we need to earn enough revenue to pay for ourselves, and that we are not and will not be paid for our operations through state general fund dollars. So just to get into a little bit more detail about who we will serve, again, starting in October, we will be serving Coloradans who need insurance, who would be uninsured, perhaps somebody who would be leaving a large company and wanting to start his or her own business, and families, again, who need insurance, and employers. These are businesses and nonprofits with 2 to 50 employees. And so, if you get insurance through an employer with more than 50 employees, and that would include myself. I have insurance through my husband's company, and so I would not be a customer of our marketplace. You would continue to, you would be expected to keep that coverage, and there wouldn't be a need to come to us to look for coverage. People will shop primarily through the website, but again, you will be able to get extensive assistance by phone and in person. And I will get into that fourth bullet around the comprehensive coverage, and this is essential health benefits, which I would expect that many of you would be familiar with. And the sole differentiator with our marketplace is that we are the only access point for the new federal tax credits and subsidies to reduce your premiums, co-pays, and deductibles. And I'll get more into that in a bit. And the last bullet is one that I really want to emphasize. You may have heard about a lengthy application process. This application form that the federal government has released for people to apply for the new tax credits. And it is true that it is a lengthy application. However, what we will be offering in October are many ways for people to get into the shopping process and to start looking for plans very quickly. I want to be clear that the financial assistance form is necessary, but only for people who want to apply for it. So people who want to come and look for plans through our website who may, earn too much or may not be interested in taking advantage of that assistance, they would not need to fill out that form. And so there will be quick ways for you to get in and start looking at health plans. You can also get a quick estimate on what your potential financial assistance would be. And you can shop, in a much quicker manner without going through the full application process for the financial assistance. So our goal is to make this process of accessing coverage as accessible as possible for our customers. And then on the small employer side, we will, again, be serving businesses and nonprofits with between 2 and 50 employees, and that's a full-time equivalent calculation. Starting in 2016, we will be offering plans to employers with up to 100 employees. The big benefit for small employers in Colorado to use our marketplace will be the ability to provide greater choices of health plans than you can do today. Small employers today can only provide choices from one health insurance company. And when we open, employers can come and they can offer multiple plans across multiple carriers to their employees. They can also restrict choice if they only want to offer one plan to their employees. That's their choice as well. The employers would set their contribution amounts and different parameters around the small group plan, and then the employees would come in and pick based on the parameters that was set by the employer. There is a tax credit for the employer, and this is for employers with up to 25 employees who earn an average of $50,000 a year or less. And that tax credit could cover up to 50% of the premium for all of the employees. We also will be providing other types of services, such as aggregated billing, and that's what that is that if an employer chooses to offer the employees say 10 plans from 5 companies, and then the employees come in and they make their choices, the employer would make one check, and then we would divide up those payments across all of the companies based on the choices made by the employees. Okay, and here's just some more detail about the new tax credits from the federal government. The way that this works is that the tax credits are available to people who are going to make too much for Medicaid. And I do want to take a moment and explain, if for those of you who may not be aware, that Colorado is intending to expand the Medicaid eligibility to 133% of the federal poverty level this year. And so what that would mean is that when people come to our marketplace starting in October, and they would be applying for coverage, if they earn up to about $15,000 a year, they could be eligible for Medicaid, and that's a huge increase for a single adult. Today, the eligibility for a single adult with no dependents is about 10% of the poverty level. And so if this expansion goes through, which it is planned to do so, about 160,000 more Coloradans would be eligible for Medicaid. And so these tax credit eligibility levels are based on being higher than the Medicaid eligibility and then up to 4 times the poverty level. And so for an individual, the income eligibility would be between about $15,000 a year and almost $46,000 a year. And that's a sliding scale tax credit, so that the less money that you make, the larger your tax credit will be. And then as you make more money, your tax credit gets smaller in its amount. For a couple, the eligibility is between about $20,000 a year and $62,000 a year in income. And this is household income. I want to emphasize that. On a family of 4, the eligibility is between $31,000 and about $94,000 a year. It is estimated that almost 500,000 Coloradans would be eligible for this tax credit. The great thing about the tax credit is that the customers can apply it up front to reduce the cost of their monthly premium. That is going to be their choice. They can also choose not to use it up front and then take it off their taxes in the following year. And another great thing about the tax credit is that for older Coloradans, and these would include some of your boomers, between the ages of 55 and 64, the tax credit is higher. And what that means is that if you, say, are a 60-year-old individual and you choose the same plan as a 30-year-old individual and you earn the same income as the younger person, your premium cost would end up being the same because your tax credit would be higher to cover that additional cost to you. And so this is a great benefit for people who are not quite Medicare eligible or who may be retiring early and who really value having that health coverage and need help with affording it. There is a second type of financial assistance that the federal government is also providing. The first one that I was talking about was related to reducing your premiums and both your monthly payments to have insurance. The second type has to do with reducing your out-of-pocket costs. This is a benefit that's eligible, that's available for a smaller subset of people. It's people who make up to about 250% of the poverty level, and you'll see those income levels there at the bottom of the slide. And what that means is that if you're in this income bracket, you will get 2 types of benefits. You will get the break on your premium. You will also be able to pick a plan that has lower copays and deductibles than somebody who earns more than you. And so there will be that dual benefit of paying less on a monthly basis and also paying less for your out-of-pocket costs. And here's an example that is not based on actual prices that we will be having, because the prices will be, we'll know the prices from the Division of Insurance in the next 2 weeks once the carriers submit their paperwork. But just to give you a sense of how this would work, if you have an adult who's 40 years old, who earns about $30,000 a year, and he comes in and applies for the financial assistance, that he could qualify for $166 per month in the new tax credit, and he would apply that to a plan that costs about $375 per month, and so that his what he would need to pay on a monthly basis would be about $209 per month. And again, I want to emphasize that the actual prices we'll know within the next month. Okay, and then here, you may have heard this as essential health benefits, and what we wanted to explain here is that one of the changes that is occurring is that the health plans that will be offered through our marketplace need to have all of these services in every plan that we offer. And this is a federal requirement, and what it is intending to do is to ensure that there's a quality of coverage in the plans, so that when people are getting health plans, that they are getting the services, access to the services that they need. And so you'll see here that it covers a pretty wide array of services that includes mental health and substance abuse care, prescription drugs, hospitalization, emergency services, rehab services, and pediatric oral and vision and general wellness care. And plans can, and we expect that they will, offer additional benefits on top of these that are required. And the customers, when they come to our marketplace, will be able to choose. They can choose the ones that include the essential health benefits, and they can also look for plans that have additional benefits available. So just to recap on what we are offering to Coloradans, and knowing that this is a choice. There is no requirement to come to our marketplace. We will be the sole access point for Coloradans to get the new tax credits and cost-sharing subsidies. But it's our job to make this an attractive option for our customers. And so again, it's about giving you a one-stop shopping experience to look at your coverage side by side, providing you with more choices. We are very excited that more health insurance companies are going to come into our marketplace. So that gives our residents more choices and more competition. And again, we will be providing the additional assistance, and that will be through a customer service center that will be built in Colorado Springs to offer assistance by phone. For people who don't have access to the internet, they can request a paper application through our customer service center. And we will be working with brokers. And we will also be providing grants and launching what we call the Assistance Network, which will be organizations that currently exist across Colorado who will obtain grants to provide local in-person assistance to Coloradans to use our marketplace, sign up for, apply for the financial assistance, and enroll in coverage. And that is a program that we will be rolling out this summer. And finally, it's just our job is to work with partners, including the medical community, around making sure that people know about this. And come check us out and make this an attractive choice for people across the state. I want to talk a little bit. I think these are going to be questions that the provider community would be interested in. This is, again, our marketplace does not, we do not play a role in the agreements between the carriers and the providers. We do want to encourage you to be going through your agreements and negotiating with the carriers, also knowing that there will be new carriers coming into the marketplace, and so we're hoping that you are aware of that and talking to those carriers about being part of their network. Again, we want, the Medicaid extension will have a significant impact across the state, and that there is a general expectation that there will be an increase in demand for healthcare services, and that we are working with provider groups to, we know that there are provider groups who have applied for the Assistance Network grant, and so this is a great opportunity for increased collaboration to be providing health coverage across the state, and therefore to improve health outcomes in our community. Just wanted to touch on here about the participation that is occurring across the state and the outreach that we are doing. And we have open board meetings. They occur about twice a month, and all of that information is on our website and all of the materials. We have a speakers bureau that is launching, and we are very interested in working with medical providers to be part of that. We are very excited about a partnership that we've developed with the Colorado Center for Nursing Excellence, where we have some volunteer nurses who are going to be doing speaking about us and about different aspects of the changes that are occurring in healthcare. We have weekly email updates that we send to a growing number of people, so you can sign up for that. And then we have advisory groups, and there are 4 types of advisory groups that meet at least on a monthly basis to discuss different topics that are important to our planning and implementation, and to provide recommendations to the board as they consider shaping the way that we operate. And just to give you a sense of how much work we have going on, it is an incredibly busy time. We are submitting a final grant application to the federal government within the next few weeks to ensure that we have sufficient funds to implement and support this operation until we are self-sustaining. It is very important for us to be doing more education and outreach. We will be launching an advertising campaign next week, and so you'll be seeing us on TV and on the radio, and on transit and buses, and on the internet. And so we're very excited about that, and we know that this is a huge challenge. We can create a wonderful system for people, but they need to know about it, and in order for us to be successful. And so we encourage you to be part of that process. We need to open up this new customer service center and work with carriers again. We have to make sure that we are offering all of the information about the plans and helping people to look at the details and to enroll in coverage. Again, get all of that training done to make sure that we are providing high-quality assistance to the individuals and families and small businesses that will come to us. And, of course, with opening in October, the open enrollment period will, for the first year, be 6 months, from October through the end of March of 2014. After that, starting at the end of 2014, the open enrollment periods will essentially align with the Medicare open enrollment periods, which are between October and December of each year. And just to touch again on the importance of the provider community on the education front, we know that Coloradans really value the advice that they get from their physicians and medical providers, that they are very highly trusted, and that we would hope that encourage you to send the message about the importance of being covered and the different ways to find coverage. That people who have health insurance are more likely to be healthier and to not have to deal with major financial problems. And so this is a community effort that we would like to, again, invite you to be part of, and again, with the goal of improving the health of our state. I want to show you, again, this is our new look. We are going to be Connect for Health Colorado starting next week. And so when you will be seeing us through the advertising as Connect for Health Colorado. We chose this name through a community and stakeholder engagement process based on unanimous feedback that the Colorado Health Benefit Exchange was not a very useful name to be using for our state, and it did not really convey what we do. And so, again, we will be known as Connect for Health Colorado. The name Colorado Health Benefit Exchange will continue to exist as our legal name, but we will be, doing business as Connect for Health Colorado. And if you want more information, our new site is currently up as a placeholder site. It will be fully functional starting on Monday, and that is connectforhealthco.com. Our current website is getcoveredco.org. But all of the current website, if you go to that website, it will direct you to the new one. And I also want to offer my personal contact information if you have questions. My phone number is 720-496-2531. Again, that's 720-496-2531. And my email address is mkim@connectforhealthco.com. Right now, you can also type in cohbe.org, mkim@cohbe.org. We are in a sort of we're in a transition period, but again, starting Monday, everything will be under connectforhealthco.com, and we encourage you to follow us on Facebook and Twitter. We will have a YouTube channel with videos of real people and interviews that we're doing on Spanish language TV and on different outlets. And I'm trying to think, was there anything else that I missed here? But again, I appreciate the opportunity to be able to be with you today, and I would like to open up the phone lines for questions.
All lines are now open.
Okay, I see that there's a question on the webinar asking about when we'll know the pricing. And that the answer to that question is that the Division of Insurance will be receiving all of the forms from the carriers, I believe, by May 8th, that we're talking about next week, and then they will be making that information public shortly thereafter. So it should be, again, within the next couple of weeks that the pricing will be, will be disclosed by the Division of Insurance. Anybody else like to ask any questions?
I have a question.
Sure.
You indicated that you don't receive any external funding. What do you charge the customer for this consultation service?
So the way, are you asking about the how we're going to finance ourselves, essentially?
What do they have to pay you?
They don't. Okay, so I'll walk through the process of how we're going to pay for ourselves. The funding mechanism to maintain this marketplace will come from several sources in the initial years as we grow our enrollment. And so there are two sources of funding that currently go to Cover Colorado, which is the high-risk pool, and those come from carriers. And so there's legislation currently going through the General Assembly that would allow us to access those funds temporarily in the early years to support our operations. And so that's carrier money, not from the customer. And then the board of our organization approved a 1.4% administrative fee on all of the carriers who will provide plans through our marketplace. And so that will help us to gain revenue. The bill that is going through the legislature, I believe, will also have a temporary assessment on carriers of, I think it was $1.80 per member per month for a maximum of 3 years. So again, the Cover Colorado and this assessment on the carriers, those are all transitional temporary funds to build a revenue base in the early years, and then we would be sustainable through the administrative fee on the carriers going forward based on our enrollment. Does that answer your question?
Yes.
Okay, thank you. Are there other questions?
I have a question.
Yes.
How many insurance carriers are now going to be participating with this marketplace?
That's a very good question, and that is the information that will be submitted to the Division of Insurance by May 8th. So we will know then after this filing occurs. We do know that we have what I can tell you. The short answer is we don't know specifically all of the carriers that will be providing plans for our marketplace today, but we have been working with all of the major carriers around planning for this, and this is, again, from a technological standpoint, there's a lot of work that needs to be done to make sure that the carriers' plan information and the enrollment process can occur through this electronic system. And so all of the major carriers have been working with us, including the new ones that are intending to operate on our marketplace. We expect to have up to about a dozen different companies offering plans, and the number of plans we are confident it will be in the dozens, if not over 100 plans. But again, all of the details of that will be known once carriers have filed their paperwork by May 8th. Did I answer your question?
Yes.
Great, thanks.
I have another question, and that is how income is determined for the individual, what line on a tax form determines.
Yes. So the way that the income will be determined is through what they call a modified adjusted gross income calculation. And this is household income, which does not include assets, from what I understand. It is a simplified income calculation compared to what people go through now to apply for Medicaid and other public benefits. I don't know about the line on the tax form. I'm sorry. I think the reason why is because this is a new type of calculation, and so it's possible that the IRS is changing the form to accommodate that. And I see that there's some questions on the webinar, and so I'm going to try to answer some of them. So somebody asked if these slides will be available, and the answer is yes. The Colorado Academy of Family Physicians has this slide deck, and I am certainly happy for them to distribute it. Let's see if there's any other questions.
I have a question.
Yes.
You were mentioning the first open enrollment begins in October this year.
Yes.
And then it ends in March of 2014?
Correct.
What will the community do after the end of March as far as going into the exchanges and purchasing insurance after March?
That's a very good question. So the way that this works is that, we have this extended open enrollment period for the first year to, help get as many people on board as possible. And I want to just give you a little bit more detail around that if you want to have coverage starting in the beginning of the coming month, you will need to apply prior to the 15th of the previous month. So when we open in October, the plans that people will enroll in will start becoming effective in January of 2014. So there isn't a huge rush for people to come and sign up on, October 1st, because they'd still have to wait until January 14th. And so if you want to have coverage starting on, January 1st, if you want to have coverage starting January 1st, you would need to apply by December 15th of this year. And then beyond the open enrollment, so say you move to the state, or you lose your job, or you have some type of what we call a qualifying event after March 31st, you should be able to come in and shop. But it's not the process of creating open enrollment periods is to try to create some structure around making sure that people are not coming in and out of coverage, and to try to get people to sign up and then stay on their coverage for the year, unless there is, again, a life change event. So it would be a loss of a job. It could be a change of a job, a birth of a child, a marriage, that sort of thing. So there will be a number of qualifying events that would allow you to come in and obtain coverage. But in general, we will be encouraging people to sign up during open enrollment period. Does that answer your question?
Yes, it did. Thank you.
You're welcome. Everybody knows everything they need to know. There will be a lot more information coming out as we go through the summer, again, as we know the rates, as we know the specifics on the health plans, and we can be a lot more specific about, what your tax credit could be. And, again, our job is just to make this as transparent and useful and for people as we get closer to opening, and then during open enrollment to hopefully be everywhere across the state and providing the adequate level of assistance so that people can get through this process and make, good informed choices as they're looking for coverage.
I do have a question.
Yes.
Is there a minimum or maximum deductible that is required through the federal regulations? And if not, then will the plans be offering a variety of deductible options through their through each carrier, I guess?
Yes, that's a very good question. I know that there are out-of-pocket limits for plans, so that a family cannot spend more than I want to say $12,000 a year, but I need to check that total out of pocket. Are there regulations around deductibles? I think the answer to that is yes, but I would need to get back to you on that.
Okay.
Sorry about that.
No, that's not a problem. Not a problem. Yeah, my concern there was, not really concern, but I was wondering, if plans are offered with extremely high deductibles, then it ends up not necessarily being the original intent of the law, I didn't think. That's how I was kind
Sure, yeah, I understand the question, and I'm sorry I haven't been as involved in that piece of the planning. Although I do know that we will be providing what we call a cost calculator, so that people can determine they can be looking at their plans and evaluating them not just based on the copays and deductibles and the premium, but a sense of what their total cost could be throughout the plan year. And so they can, provide answer questions about, what their needs are for services and what their expectations are. And so they can get this, bigger picture of what that total cost look like as they're looking at their plan options. Well, I know that we're ahead of schedule, so this is very exciting. If there are more, I'm open to questions, and I also, want to keep the door open to future questions. And if you want to become involved with us as a volunteer or as a speaker, or just want to check back with us, or also would you be willing to allow us to, perhaps drop off some, brochures in your waiting room, that sort of thing. We will be doing a lot more proactive outreach with the provider community this summer, and really hoping that we can work together on making sure that our communities know about the changes that are happening and about the different options that they have available to them. All righty. Sounds like there are no more questions, but you know how to reach me. And thank you again to everybody.
Thank you.
And we're happy to do this again, too, if you'd like us to come out to your communities. We also have outreach coordinators who can come and visit you as well. So we hope this is the beginning of more partnerships with everybody.
Thank you.
Okay, bye-bye, everybody.